Okay, I'm Patsy Brand, and the doctor had told me, I had been going to this ophthalmologist for several years, and he told me that I had cataracts and I needed to have them taken care of. So I started reading, and I found out that they had this new lens that was called Restore. I think it's what Dr. Wang calls the Forever lens. And I thought, well, that would be great at my age, that I wouldn't have to worry about glasses or whatever. So I did read about it, and I had talked with a couple of people that he had done cataract surgery on, but nobody that he had used this lens on. But I decided to go ahead and have that. And we got into the surgery, and it was supposed to have been a 30-minute surgery, and I was in probably 3 hours. But when I came out, well, everything was supposed to be, you know, he said, just had a little problem in there, but everything's fine. And it was not fine. It was so painful that I was back the next day, and he was not there. But I did see another, okay. I did see another doctor that was in there, and he said, well, he wasn't sure what was going on, but he thought I'd be okay to use my drops more frequently. Well, it did not get better. And as he said, I had 2 more surgeries, and he insisted that I have the left eye done. And I thought, no way, I've got to have this other eye so that I could kind of see. But finally I saw another doctor, and this doctor said, well, you know, they wouldn't recommend that I have the other eye done. So I had known about Dr. Wang because he did LASIK on our son probably 5 years ago. And it was just a fabulous thing, and he thought he was really good. And I thought, I wonder why he does not do cataracts. And I started checking and found out that he did. So I came in and talked to him, and he saw my records, and he said, well, I had several problems. And the doctor just did not have the skills that he had. That he told me the percentage, that he had never had a bad outcome. And through the United States, I forget the percentage, but we're not up to 90-something%, I think, that he has. And he said, I can do your left eye. So I did, and I've had no problems at all with this. But he has been very patient, he and the staff, working with me for this other eye, and we are still working on it. I see perfectly out of this eye, but this eye, I have a cloud over it. I don't drive except just right in my neighborhood, and I can't read. I can't follow the lines. I get to the right side, then I have to count down. And I have solved that by getting a computer and making the font bigger. And so I am reading, but I still cannot drive. And my husband has been a very good chauffeur. But this eye is good. This eye is bad. And when I put them both together, it messes, my vision is not what it should be. But he has some things that he's trying, and I have confidence in him. He told me that he didn't do anything unless he could do it well and unless he thought he could have a good outcome. And I have been very pleased, and I would recommend him to anybody.